You know, addiction is a complex medical condition, just as addiction looks different in each and every individual experiencing it. Recovery can look different as well. Now, no two addicts are the same. That's why recovery is not a one-size-fits-all process.
Yeah, medication-assisted treatment, or it's called MAT, is the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of substance abuse disorders. And that's an approach used by Addiction Medical Facility in Seaford. Ronchetti Whittington is with us this afternoon. She's the site director. Thank you so much for joining us this afternoon.
Good to see you.
Thank you.
So, when did you originally establish this entire idea?
Well, as far as medication-assisted treatment,
Right.
it's been around for quite some time.
Yeah.
It's just the use of providing medication in conjunction with therapy and counseling.
Well, what made you get involved and want to do this?
Me, I actually started back in 2016.
Okay.
I worked in a residential facility, and it just caught a hold of me, and I just couldn't let go of it. So I've been in different capacities, from acute, the residential component, to the MAT component, to housing, and I just love interacting with patients, just from interactions from personal experience and also just interacting with patients. I just love the community.
Yeah.
And we're going to talk about an event coming up, but first I want to learn a little bit more. When people arrive to the facility, what is the first step? What process do they go through?
The first step is assessing their needs. So we just want to, through medical attention and clinical, just see where they stand, meet them where they are. So we have the provider assess them, just to see where they fall in as far as treatment measures and medications. And then we'll have a counselor follow behind and see, okay, well, what do we need to do to make them whole and help them in the recovery process so they can go back out into the community.
Okay, so you started getting interested in this in 2016,
Yes.
you said. So since then, I'm sure that you've had people that have gone through this system with you. Have you gotten anything back from them, any feedback?
Yes. It's pretty rewarding when I see individuals that come back to us and say, hey, you know, you all really helped us, and we wouldn't have been where we are without your assistance. So it just is very rewarding for me to see people come from such a low time in their life to, you know, have bought houses, have bought vehicles, that have a rewarding career. So that just makes it worthwhile for us to be able to continue to do what we do.
And recovery is something worth celebrating, isn't it?
Yes,
and,
absolutely.
And you have an event coming up to celebrate recovery. Tell us about that.
It is called Standing in Unity, and it's just support. It's just providing awareness, you know, for those who have made it and who are successful in treatment. It's just with the stigma, we're just trying to provide support and just let people know that we're here for them.
Right. Let me ask you, we've also talked medication in the treatment. How does the medication work in a treatment?
So the medication helps because it is something that's going to help with the cravings. It's going to help individuals not want to go out into the community to use other illicit substances.
Right.
So that's why we have the medication there, but it's also important to have the counseling measure because you have to be able to cope with difficult situations. You may go around individuals that you have been familiarized with that will take you back to a place, and being able to deal with, okay, well, I'm around these individuals, but I don't have the urge to do anything to hurt myself or to retract what I've accomplished so far.
Right.
So if somebody is watching and they maybe themselves or know somebody who wants to look into this, what's the first step? I mean, how do they get up with you?
For us, the difference for us is we provide intakes or admissions Monday through Friday from 5 a.m. to 11 a.m., which is a difference from most MATs. Usually it's on certain days. We have a provider there every single day that will be able to assess a patient's needs. And it's always the first step, because the first step is always the hardest step, whether it's your first time, your second time, your third time, your fourth time, because a lot of times as far as evidence-based studies with relapse, you're going to, it's a percentage where you might have a moment where you might relapse, but it's okay to pick yourself back up and start over again.
Yeah.
Yeah.
All right. Ranjende, thank you so much for coming in and talking about this important subject, and good luck with the event. We'll have information on our website so folks can kind of join.
Thank you.